Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to discuss one topic regarding the fever medications. Many times the parents ask that whether I should give paracetamol drops or paracetamol syrup or the suppository or the tablet. When to use which type of the formulation, that is also very important to know. Many times parents use the tablets and the child vomits. So what is the difference between all these formulation and why it is designed and what are the purpose of having this much formulation of the paracetamol to reduce the fever? That is important to know. So today I will discuss the various formulation of the paracetamol medication and when to use it and what are the advantages of using that formulation for your baby and how to choose the correct formulation for your baby. That all we will discuss today in this video. Friends, fever is a very stressful situation. Specifically the young new parents, when they see that their child has the fever, child is getting cranky, more irritable, then their stress level rise very fast. So it is very important to know the medication to reduce the fever and which formulation to use to reduce the medication. As we discussed in the past also many times, that what exactly is the fever. Fever is basically body's response to whatever coming from outside. It can be the virus, it can be the bacteria, it can be parasite, it can be the fungus, something like that. So most of the time fever are related to the some or other infections, and our body's normal temperature is ranging from 98 degree Fahrenheit to 100 degree Fahrenheit, and in the Celsius from 37.5 degree to 38 degree Celsius. Now once the temperature crosses 38 degree centigrade or the 100 degree Fahrenheit, then the child will become more cranky, irritable, and child has the other features like the headache, body ache, and the smaller children start getting more dehydration. They will not eat well, their urine output start getting compromised, and all those things happen. So it is important that when the child is in discomfort because of the fever, to treat the temperature. So when the temperature goes more than 38 degrees centigrade or somewhere around closer to 100 degrees centigrade, and if the child looks visibly dull or you feel the child is in discomfort, then to give the comfort we will give the paracetamol drops, syrup, tablet, or whatever formulation available. So when to use the paracetamol drops and why the paracetamol drops is in the market. So paracetamol drops is the highly concentrated product. If you will read the concentration, it is 100 milligram in 1 ml. So for the smaller babies like the infants, where they cannot take the larger amount of the medicines, we advise to use the drops. So suppose if you consider the baby is of 8 kg and if you want to give the adult drops, around 1.2 ml drops you can use. But suppose if you have to use the paracetamol syrup, so now the paracetamol syrup comes in a various formulation, but 125 milligram per 5 ml and 250 milligram per 5 ml, two are the commonest used formulation for the paracetamol syrup. So same weight child like 8 kg child, if you want to give the paracetamol syrup, then the dose will be 5 ml. So now you can see that paracetamol drops are very concentrated. So for 8 kg child, you have to just give the 1.2 ml of the drops, but if you have to give the syrup, then you have to give the 5 ml of the syrup. So like if your baby is smaller, infant age group baby, then you can prefer to give the drops because your medicine requirement is less. But when there is a concentrated medication, you have to be very careful to give the medication. If you will give the more dosage, if you will give the overdosage, then the chances of the toxicity or the side effects of the medication can be there. So one thing is very clear, that drops are usually more concentrated so that we can reduce the dose, because child will not take larger amount of the medication. Now paracetamol suppositories are also available. Generally 125 milligram and 250 milligram suppositories are available. Even in some countries 100 milligram, 200 milligram suppositories are also available. So now when to use the suppository? Suppository is one of the route of giving the medication. It doesn't mean that it is very stronger or powerful medications to reduce the fever. Many parents has belief that suppository works faster. Yes, it works faster, around 10 to 15 minutes earlier effect you can see. But overall medicine is same, whether you give the drops form or the syrup form or in the suppository form. But with the suppository form you will see the little bit faster effect. Many times the children are vomiting. So when they are vomiting, and if you want to give any medication, child will not tolerate. Child will again vomit out the medication. So like if you want to give the paracetamol for the fever reduction, but if the child is vomiting, then paracetamol doesn't stay in the abdomen, so that his fever will not go down. So in this type of the situation, you use the paracetamol suppositories. Now many children are quite reluctant to take the medications. So whatever you do, whatever you try, but they don't take medication. Those type of children also you can use the paracetamol suppository to reduce their fever. Otherwise their fever keeps on coming and the child is not taking any medications. So what we have discussed is the paracetamol drops, syrup and suppository. These three formulation. The drops you will use in the smaller children or the children who are not able to take the larger amount of the medication. You can use the drops because the dosage will be very less. Approximately after 1 year of the age, child can take the syrup well, so you can switch over to the syrup. The children who are vomiting or quite reluctant to take the medication, you can use the suppository of paracetamol. Now tablets of paracetamol is also available. So like the bigger children around 6 years or 7 years of the age children, the children who can able to swallow the medication well, if you will give the tablet, they can take the tablet well, or some children also chew the tablet. So in those children you can use the medication like the paracetamol in a tablet form. And some of the children where there is no any other options, like they are very sick and the still fever is there, many times we give the injectable paracetamol also, but that is to be given in the hospital, so that we will not discuss here. So to reduction of the fever is important, but the reduction of the fever is required when the child is in discomfort. Just don't keep on giving every 5-6 hour paracetamol just to reduce the fever, because fever can be because of various reasons. It can be because of the viral infection, it can be because of the bacterial infection, it can be because of some pneumonia. So to treat the cause of the fever is important. Fever is just a symptom which tells that there is something wrong in the body. It is not a disease. Disease is something different. It can be like the brain fever, it can be malaria, it can be typhoid, it can be pneumonia, it can be any. So first we have to find out the cause of the fever, and we have to treat the cause of the fever so that the fever will start going down. But meanwhile, when we are not able to find the cause of the fever and we have to just reduce the fever, we can use the paracetamol. Many parents has the habit to give the paracetamol every 6 hours, 8 hours just to control the fever. So that is not required. In many countries, there are various other medications available to reduce the fever, like the mefenamic acid. That is not recommended. Only fever reduction medication we can consider. One is the paracetamol and second is the ibuprofen. These two medicines are only medication to reduce the fever. So don't use the other medication to reduce the fever. In some countries, the various combinations of the fever medication like the paracetamol and ibuprofen in one bottle, paracetamol, ibuprofen combined medication, that is also not recommended to just reduce the fever. But in certain cases, like where you need to relieve pain also, like the fractures where you need to reduce the pain also, in those cases paracetamol with the ibuprofen combination is somewhat useful. So on an average, if you will consider what we have discussed is the various formulation of the paracetamol, what is the fever and when to treat the fever, all the formulation, when to use and how to use, that we discussed. And the last thing, that don't use a combination medication to reduce the fever. I hope I have tried to give you little background that when to use which formulation. If you find this information useful, you can like the video. You can share this video with your colleagues, friends, so that they also get acknowledged when to know when to give this kind of the medications. Thank you very much.